every injury is unique, every injury is its own entity, and every horse is an individual. So what works for one may or may not be appropriate for another type of injuries.
Welcome to Equine Management's podcast, Disease du Jour, where each podcast will delve into the research and current best practices for a variety of equine health problems with industry experts. I'm your host, Kim Brown, publisher of Equine Management. Today's guest is Dr. Duncan Peters, a DVM and a diplomate in the American College of Veterinary Sports Medicine Rehabilitation. He's also a Certified ISELP Member. Dr. Peters is the co-owner of East West Equine Sports Medicine in Lexington, Kentucky. He is a leading authority on locomotor pathology, diagnosis, treatment, and managing sport horse health for optimum performance. He is a multidiscipline licensed FEI veterinary delegate and is an FEI certified in dressage, eventing, jumping, driving, vaulting, and reining. Dr. Peters has served as director of the Clinical Equine Sports Medicine Program and associate professor of large animal clinical sciences at Michigan State University's College of Veterinary Medicine. Prior to that, he was director of the Sport Horse Division at Hagyard Equine Medical Institute and developed Pioneer Equine in Oakdale, California. Dr. Peters was a team vet for the U.S. Pair Equestrian Team at the 2018 WEG and Tryon. He's also a member of the Veterinary Selection Panel for the USA Eventing Team. He enjoys assisting clients manage their sport horse programs, and he actively participates and competes in hunter-jumper shows and fox hunts. He also loves fly fishing when time is available. So thank you, Dr. Peters, for joining us today on Disease du Jour to talk about tendon and ligament injuries and rehabilitation.
I'm happy to be here. Thank you very much.
Okay, so you and I have talked, and you have said that most veterinarians do a really good job of diagnosing these injuries. So when you're talking about rehabilitation, what is the first thing you need to do?
Well, I think have an accurate diagnosis is certainly paramount. And with the technologies we have now and with the expertise of a number of practitioners that are well versed in these things, it seems like we start out knowing what we're dealing with is all important. But from that point forward, it's really, if you're dealing with an acute injury, it's really trying to decrease the inflammation that's associated with that injury. Then it's going through what we call a subacute stage, where the body then has to decide how it is going to repair that. And then we get into a chronic phase where the tendon or ligament has to take that scar formation or that reparative process and mature it up to the point that that tissue is again strong enough to get back to the original discipline that caused the injury. So those are sort of the three phases that veterinarians and their staff and any rehabilitative therapy has to deal with along the way. Now, the interesting thing about that is that acute stage is relatively short, and that's where the owners are a little bit frantic sometimes, a lot more concerned. What's this going to do? How's this going to affect competition? So on and so forth. But that acute phase, usually within the first 7 to 10 days, up to 14 days, is really to get rid of the inflammation, quiet down the active damage that's going on there, and help the body sort of clean up that area the best it can. The subacute stage, or the other term we use for it is called fibroblastic stage, is during which the body all of a sudden sort of turns and says, okay, I've cleaned this up, I've gotten rid of as much inflammation as I can. Now, what are we going to do to repair it? We need to put this back together so that we have some healing that goes on. This is a period that can occur anywhere from this 2 to 3 weeks up to about 70 to 90 days. So it's an extended period, but really the ability for the veterinarian to sort of work their magic or be involved with the actual reparative process usually occurs up to about 45 to 60 days after the initial injury. So this is a period where we can do things like regenerative therapies, where we can take a tendon lesion and inject it with stem cells or platelet-rich plasma, PRP, or we can use some cross-linking synthetics like Genopin or NovaBrace, it's called. So this is when we can really help strengthen those tissues, activate the normal growth factors, reparative processes within this area, and get the body some help in terms of repairing the injury that's there. The other thing that occurs during this time is a lot of treatment modalities that help to assist and support the tissue metabolism during repair. And these can be laser therapy, they can be ultrasound therapy, they can be shock wave in some instances, they can be pain relief mechanisms that are involved. But a lot of the treatment modalities are used during this time. Pulse magnetic field therapy, TENS units, that all have an effect on perfusion, they have an effect on cell metabolism, they have an effect on recruiting other cells in terms of growth factors that may be helpful in deciding how the cells are going to react in an area, and help building that matrix as well as the collagen back and repairing that injury either in that tendon or ligament. And that process is very effective in terms of getting those horses back to where they should be. The other things that we can use are our rehabilitative therapies during that time. And in the acute phase, obviously we don't want to put more stress on the tissue. So it's a minimal loading period. And again, that may be relatively short, a few days, or it may encompass a couple of weeks. But just like in human therapy, rehab now, we like to start doing some minimal loading as well as range of motion work early on. And those things actually help to stimulate the reparative process, but it also decreases the possibility that you will have some abnormal filling of the injury or abnormal fibrosis that occurs that's going to limit you down the line that you may have to deal with. So in a lot of cases we like to start these rehabilitative processes or procedures early on, and they can be static range of motion, they can be things like just hand walking, they can be mechanical walkers in some cases, they can be aqua therapy in terms of walkers and aqua treadmills, things like that, or they can be even spas that have a whirlpool-like activity. All these things can help with perfusion, range of motion, and the way the horse responds in those rehabilitative therapies can be helpful down the line in terms of stability of the repair, and also those tendons and ligaments affecting joint mobility around the body. Now, once those things are incorporated, different protocols allow you to do different things, especially with water therapy, in terms of whether or not you want more flexion of an area, whether you want decreased flexion of an area, whether you want to change the stance phase or the swing phase of the stride. Things like that can be manipulated depending on some of those rehabilitative therapies. So that becomes important depending on the type of injury you have. If you've got an injury associated with, say, the deep flexor tendon, that's sort of a push-off, a propulsion. Well, you may not want to put a lot of stress in that area, versus something like a suspensory or a superficial digital flexor injury, which is more of a stance phase type of injury. Then you may do some water therapy that's different. You may want to decrease the weight of the body so that you have more buoyancy to the body by using the water, but you have less concussion or strain on a weight-bearing type of structure. So things like that are very helpful. And it's a matter of knowing what device will give you the desired effect. And those are things that unfortunately you just have to go look up in a lot of cases or talk to other people that are dealing with it in terms of trying to find what do I need for my particular injury. Again, because every injury is unique, every injury is its own entity, and every horse is an individual. So what works for one may or may not be appropriate for another type of injury. So that's that accurate diagnosis, what tissues involved, the extent of the injury, all those are very important in terms of going through this middle phase, this subacute phase, and the type of treatment you use, as well as the type of therapeutic modalities you use. Not everyone has access to everything or economic feasibility for any of these modalities or therapies. So it's a pick and choose, and it depends on what your client's desires are, what is available to you in an area, and also what the expectations might be for the horse down the road. If we're looking for a pasture pet, that may be a whole lot different than a horse that you're hoping to get back to its original discipline level. So all those play a tremendous amount of role in making decisions along the way. But again, you only have a short period to decide how much intervention you're going to do in order to affect the functional healing of those ligaments and tendons. And again, that's usually within that period of a couple of weeks up to about 60 to 90 days. And so things have to be done primarily at that time. Once we get out of that range, we're pretty much dealing with the fact that you've got a reparative process that's bridged the gap, that has closed the lesion, and at that point you're looking to have a exercise program that loads those tissues and allows those tissues, that reparative scar, to mature and continue to develop a functional aspect for whatever the expectation is. And that chronic phase of that tissue maturation and the developing that horse back to their previous level can last an extended period of time. So generally that can be anywhere from about 12 weeks, 3 months, to anywhere up to 12 months or even longer. And that's somewhat, again, dependent on the individual. Certainly I've had cases that I thought should be ready to go at 8 months. They're looking very good, and unfortunately it's another 6 months tacked on for whatever reason. And so during that maturation phase, it's usually primarily the biggest influence is the graduated exercise load that is put on those tissues. And those tissues can be stimulated and for better strength over time as that exercise load gets stronger and harder on the horse. But in the same vein, you can have a negative impact on that tissue if you go too far. And the toughest thing is knowing if we've gone too far. Hopefully the horse will tell you, but in many cases these things tend to be a bit subclinical, and it's a matter of working that balance. What is enough to stimulate the tissues to continue to mature and be able to take the load, versus are we doing too much, causing micro breakdown and not allowing the horse. And that's somewhat based not only on the load, but the frequency and the duration of your exercise program. Just like in training, you go through periods where you push the horse a little bit, then you back off and allow them to recover. Rehab's the same thing in terms of you have to put a load on there to stimulate and try to test the tissues, but at the same time you need to back off at times to allow the body to readjust, sort of get used to the tissue maturing, and then be able to take the next step. And again, there is no cookbook for that. It's one of those things that has to be worked through, has to be monitored, and we don't have tremendous validated monitoring devices or techniques for that. There are things available to be able to help us. Things like gait symmetry analysis components or machines or programs can be helpful because they can give us an objective sort of view of what is that horse doing. Simple things like heart rate when a horse works during a rehab program or exercise loading program, monitoring that and being able to say, well, today that horse came out and his heart rate was 3% higher than it normally is during that exercise phase. Why is that? Is it environmental? Was the conditions different in terms of, the weather, things like that? Or is that an indicator of pain? And so that horse says, boy, that hurts, and the cardiovascular system reacts and the heart rate goes up. So these things are all things that take time, take patience, and take monitoring to be able to deal with. We're looking into things like biomarkers out there. What's available? What can we take from the horse that can then tell us whether or not we're working them too hard, whether we're pushing them? And some of the things we're looking at are anti-inflammatory versus inflammatory proteins and the balance between the two. When a horse exercises, there are going to be, and works, there are going to be some inflammatory proteins just because of the workload. But on the other side of the coin, there are anti-inflammatory proteins that balance those out. Well, if you get an imbalance of one or the other, you're not pushing the horse enough or you're pushing the horse too much. And so there are techniques that are probably going to be on the forefront here pretty soon that will allow us to be able to more closely monitor that during training as well as during a rehabilitation program. So these things are important as we go along, as we watch the horse during the rehab process and monitor them on a very frequent basis. That's another point. Real objective assessment of that horse all the way through at a prescribed time during the rehab period, and that may be early on, it may be weekly that you're going through your rehab protocol that you've set up, and those horses are evaluated every week for a particular injury, and to see whether clinically you are making headway, whether the horse is more painful, whether there's more swelling, whether there's more sensitivity to maybe palpation. So your clinical exam can give you a lot as to whether or not things are progressing the way you think. On top of that, there are imaging techniques, and the most common, for the soft tissues or the ultrasound, to monitor those changes associated with the specific structure as to whether or not that's responding the way you think it should be. If we have a core lesion of a superficial flexor tendon at certain prescribed periods after our treatment, we would expect filling of that and development of that in a more normal progression. If that's doing what it's supposed to, heck, we're all happy as can be. If we get one of those weeks where, it looks like we have more fluid, we have more edema, or that superficial's a little bigger than what is recorded from a week or 2 weeks before, that may be a red flag to say, hey, we need to change something and need to modify what we're doing at this point in time to allow tissues to catch up, allow the rehabilitative process to catch up, allow the body repair and all the metabolic activity that's involved with that to catch up and get on the right track. So that reassessment on a very periodic and scheduled schedule is very important for the adequate repair and the best repair that we can get. And I guess I would stress for any of us as veterinarians, we all are very, very involved generally at the front end of things, but as we get farther and farther from the injury, in a lot of cases we rely on feedback, maybe from clients or trainers or people involved with the horse, where potentially maybe we need to be that objective person that comes in and looks at it and says, okay, let's go ahead and let's increase the workload, or let's back off on our workload just because of some of these objective evaluations that we're going through, the clinical exam, the imaging, that type of thing. So it's a process. It's a lot of involvement. It usually takes a lot of communication through that rehabilitative process, and there are times when it can be very frustrating for everyone involved. If in many cases you'll have a very slow progressive type of rehabilitative process, and it can be especially frustrating for owners or trainers that would like to have that horse back doing what it did before. And in many cases it's a matter of dealing with the communication aspects and reminding people that when we started, this was going to be a process, and it's going to take time, and we have to make adjustments as we need to along the way, and the whole team needs to be aware of that so that we all can support one another along the way, because it may be the veterinarian gets frustrated one day and a month later the owner's frustrated. So we have to support one another through the whole process, and realize that we all want the same thing. We want the best thing for the horse, and we want the best repair possible so that everything works out in the end.
So we're recording this during the ISELP Sports Medicine and Rehab Conference in Lexington, Kentucky, and I've heard veterinarians talk about how to manage client expectations early in the process and compliance as you're moving forward in the process, and maybe they are getting a little frustrated. So what tips would you have for veterinarians?
That's an interesting question, and it is one of the things of the art of practice and the art of communication. It can be very difficult. Expectations at the beginning, trying to give a prognosis as to where you may be at the end is very difficult with a number of injuries. So I tend to not look at the how long it's going to take to the end result. I try to take it in stages, and most people are very, very compliant and are very eager to get through the initial treatment and the initial rehab phases. So they're very much involved. I think the frustration starts to come a little later on in the process when you get into the more chronic aspects and the long-term months of the recovery. And so I tend to take it in phases. Well, let's see if we can get this inflammation down, how long that takes us. We're hoping it takes us a week. It might take us 10 days, but if we're shooting for a week, that's good. I think people can handle a week. Then we can reassess where we are, how we're doing. Then the next process is, okay, we've gotten through that. It might take us, 3 weeks or a month to get through this next part where we're actively trying to influence what's going on. The subacute phase. Well, we're going to inject it with this regenerative therapy. We're going to start with this treatment modality, and we're going to change the shoes to minimize some of the stress on those tissues, and we're going to start this rehab therapy in terms of it might be something like we're going to walk for 15 minutes twice a day for 2 weeks. Then we're going to increase that. We're going to do that on a relatively hard surface because it's going to decrease the stress on that particular tissue. And I think by breaking it down that way, that communication, everyone then can have their input into that. Well, that walking isn't going to work because this horse is going to be too wild. He's just come off competition. I know he's going to be too wild. Well, how are we going to work through that? And so that's where the communication and the teamwork comes in, and the groom may say, yeah, I can do that. The owner says, well, I can't hand walk him, and so, balancing that out and having everyone be part of it and trying to modify that as to what is acceptable. It may mean for that particular horse that he doesn't go out at a certain time when there's a lot of activity. It may be that he's a horse that is better off being out early in the morning versus out in the middle of the day. And so knowing the horse, that can have a big influence, and that's where the owner or the trainer can really impact as to what's going to be the best therapeutic approach in terms of the rehab modality that we might use in that case. Treatment-wise, again, there can be discussion about what's the best treatment scientifically, but then there may be a discussion economically, what happens with that. So the expectation of what we're going to do during that period, I think, is really a team effort. The expectations moving forward, sometimes those can change. I've had owners that say, I'd like this horse, and at the beginning of the process, it may be something like, we'd like to get this horse back. We'd like to, get it back to the same level. And then knowing that that horse is going to be out for anywhere from 4 to 6 months initially, then they may feel, this horse has given us everything. This horse has really done what we've expected. He's been a great addition. I don't want to take the risk that, we do something, that's going to re-injure this by putting him back there. And there's always that chance. That tissue is never the same as it was. So with that in mind, the expectations have changed. And so now it's a matter of finding out what works well, how aggressive we should be with our rehabilitative modalities or our treatment therapies continuing forward. So again, as the expectation and the discussion about that goes on, then it's a matter of making those adjustments in the program. The question of compliance in terms of how things work, in many cases, if a horse goes off to a treatment facility or a rehab facility, the compliance isn't necessarily an issue, and the referring veterinarian gets to work with the rehab facility. Again, a lot of discussion, a lot of cooperation there between those, and the compliance is guaranteed, so to speak. Some of the problems will occur in terms of compliance when that horse leaves that facility and is returned to either a training situation or a home barn situation where the owner either doesn't have the time, doesn't have the help in terms of personnel to assist, or doesn't have a group of people that are knowledgeable enough to deal with the further aspects of rehabilitation. And so the compliance level may drop off. That may or may not be a detriment to the horse at that time. You're hoping that repair has gone the way it should, and it may be that some of that time after leaving a facility is more of just that maturation that we talked about, and the horse already has the strength he needs there. That's what you're hoping for. But if there is some therapy once that horse leaves the facility that is more essential to that, it could be a detriment. So compliance does come into play in terms of how that horse may respond once it leaves sort of that active period of repair. The other thing about that is that there are always exercises for the horse or preventative therapies, so to speak, that may be beneficial forever for that horse. That may be some shoeing changes, that may be some nutritional changes, that may be some exercises in terms of stability or core strengthening, we call it, or flexibility type exercises that are always going to help the horse. And those may need to be incorporated into that horse's everyday life, very similar to a human injury or a person that goes through some rehab therapy, that it then becomes a lifestyle for them. We have had horses that are used to being stalled and being very competitive and not having a chance to be out much. Well, maybe part of that rehab later on is the fact that they get a chance to spend more time out, if their behavior will allow that. And it allows them to develop more flexibility, move around more, less chances of stiffness developing because of the injury that they've had. So those things are all expectation sort of discussions and communication, as well as compliance factors as the horse gets farther and farther away from that injury that has occurred.
And you're on the board of ISELP. Well, I mentioned we're here at the Kentucky meeting. Can you tell me a little bit about why you went through the training with ISELP and how you think maybe that's helped you? Because you've been working on top-level horses your entire career.
Yeah, ISELP is a tremendous organization in terms of looking at the whole horse in terms of the aspects involved with injuries and pathology that occurs in different parts of the horse. It doesn't only function on or look at the horse getting hurt and then how to treat it. It really looks at all the structures that are involved, as well as the biomechanics, and trying to understand the biomechanics and the pathophysiology of maybe why that injury occurred, what factors are important in terms of trying to manage an injury, more management than maybe direct treatment. What are things you can do based on the horse's own natural abilities of the mechanics of the horse, the dynamics of the horse in terms of getting that horse back after it's been injured. These athletes, just like human athletes, they all have injuries, and our sport horses have careers of basically injuries with good parts in between where they're very successful. So it's a matter of managing and stabilizing those injuries, and to be aware of what injuries may or may not impact them again in the future, or how we minimize the potential for those injuries to impact their performance negatively. And that may be that, horses warm up differently, or they're cooled down differently, or they get some preventative sort of therapies along the way, which may be more stretching, they may be more massage, they may be things that we do rather than just medication or injections. Certainly there's a place for those types of things, but most of these horses ultimately are probably going to respond better and have a longer career if we can manage them, recognizing that we need to build them stronger, they muscular. We need to train them so that we don't overtrain or undertrain, and to ask them to do things that are well within their abilities. These horses, a lot of them have the ability. It's where we put that ability or what we ask of them. And if we ask them to go too fast, something's going to happen. It's just, unfortunately, that's the nature of the sport. And it's one of those things that we try to do everything we can preventative-wise to try to make them as strong and as healthy as they can be for the task we ask them to do. And ISELP has been very beneficial because it looks at all those structures, it looks at all those systems within the horse: conformation, skeletal, muscular, nervous system, circulatory system, and we look at things from a sort of a whole horse type of approach, that there isn't one thing that is overly important in the horse. It's the entire unit in terms of completing the task.
And if any of our listeners are interested in learning more about ISELP, you can go to iselp, ISELP.org, and get some more information about some of the training that's coming up. And thank you very much, Dr. Peters, for joining us today on Equimanagement's Disease du Jour. And thank you for listening to our podcast. You can hear previous and future podcasts of Disease du Jour on iTunes, Stitcher, and SoundCloud. We hope you'll join us again for a future edition of Disease du Jour. This episode of Disease du Jour is brought to you by equinevetedu.com, a free online educational platform for veterinarians, vet students, and vet techs, brought to you by EquiManagement. Visit equinevetedu.com for free race-approved CE and courses on topics of current interest.